Once we take a decision to proceed with surgery, then one of the commonest questions which comes to a patient's mind is, what is the function of the gallbladder in the body? And is it unnecessary? And once they will lose the gallbladder, are they going to have any issues or problems afterwards? The function of the gallbladder in the body is to store some of the bile that is produced in the liver every day and concentrate it, and to squirt that bile into the stomach when it is required. That means after eating a big fatty meal. Most of the time when the gallbladder is diseased and there are stones formed in there, this gallbladder may not be functioning properly beforehand anyhow. However, the gallbladders with only minimal disease or a few stones may be carrying on its function and helping with the digestion. Majority of the patients do not miss their gallbladder. However, some patients may get some loose stools for a period of a few weeks after having the gallbladder surgery if they are eating rich food, because when fat reaches into the stomach, though they are having persistent discharge of bile into their bowel, but this may not be enough to do the digestion, and the undigested fat going with the feces will give them loose stool. But the body adapts to it very quickly and it settles down, and generally there is no issue or a problem. Next, the question comes that if we didn't need gallbladder, then why do we have it? And I tell my patients that I don't have 2 nails or a missing nail on my little finger. So everything that is in the body has some purpose. We as doctors, if we do not know about the function at this stage, then that doesn't mean that there was no function. So our knowledge is limited, despite all the advancements that we've done. However, what we believe at this stage of time is that the function of the gallbladder is to store a lot of bile and to produce it if we eat a very rich meal. I've lived in England most of my life, and the farmers over there, especially in the cold season, they do need lots of calories going and doing their work in the fields in a cold weather. And their breakfast is very rich, very healthy. Bacon, sausages, lots of butter and everything, and they will have it. And they will digest this away within 2 or 3 hours. Yes, they do need the gallbladder, because the water will squirt a lot of bile in there, and that it will help with the digestion of all the fatty food that they've eaten. And it's very similar to what used to happen with our forefathers when they lived in the caves and they had to go out and hunt, because they were not fortunate enough to get a hunt every day of the week. Like nowadays, when we go for a hunt, it's maximally going on our vehicle to a nearby supermarket, and we hunt the shelf and buy the beef from New Zealand and Australia and sheep from America or somewhere, and that's the hunt. Those days they had to hunt an animal and get it, and then they didn't know when they were going to eat next time. There was no refrigerator or storage, they could not store it, and they had to eat most of it there and then before it would rot away, depending on the weather and the climate where they were living. So that big meal with lots of fat in there did require a gallbladder to help the digestion of the fat. Now, what will happen to those people if they will lose their gallbladder? Probably slowly, when the gallbladder starts becoming diseased and gives lots of problems, the body adapts to itself without the need of a gallbladder. But majority of us who eat sensible food, we do not miss a gallbladder, and it works fine for us. And the treatment for gallstone disease is removal of the gallbladder, though there can be some alternative remedies and therapies which are suggested, and I'll discuss that in my next video.